Hello guys, myself Rajda Gachar and I am going to teach you about the digestive system, in that the oral cavity or the mouth, the anatomy and physiology of the mouth or oral cavity. Now you can see the figure of mouth or oral cavity. First there is teeth, then the soft palate, then in the middle portion there is elongated portion, that is uvula, then the palatopharyngeal arch, then tonsil, then palatoglossal arch, then posterior wall of pharynx, then in the anterior area there is tongue and lower lip. Then the inferior surface of the tongue there is a frenulum, which is at the middle portion of the tongue, then duct of the salivary gland at the lateral side of the mouth and the lower lip. So this is all about the part, or we can say the area of the mouth. Now the relation, that is the mouth or oral cavity is bounded by the muscles and bone, anteriorly by lips, then posteriorly it is continuous with the oropharynx, then laterally by the muscles of the cheeks, then superiorly, then in that by the bony hard palate and muscular soft palate, then the inferiorly by the muscular tongue and the soft tissue of the floor of the mouth. So this is the relations. The oral cavity is lined throughout with mucous membrane consisting of the stratified squamous epithelium consisting small mucus secreting glands. Okay, it has mucus secreting glands which secrete the mucus. Now the vestibules. What is vestibules? It is a part of the mouth where it is located between the gums and cheeks. There is area, we can say, that is the vestibules, and the remainder of the cavity is the oral cavity. Okay, between the gums and cheeks there is area which is called as a vestibule. Now we will see the palate. The palate forms the roof of the mouth. It is a roof of the mouth and divided into two parts. First one is the anterior palate, second one is a posterior palate. Anterior palate, that is the hard palate, and posterior palate, that is the soft palate. The hard palate is formed by the maxilla and palatine bone, and soft palate is muscular, curves the downwards from the posterior end of the hard palate and blend with the walls of the oropharynx at the posterior side at both sides. So this is about the palate. Now we will see the uvula. The uvula is a curved fold of muscle covered with a mucous membrane hanging down from the middle of the free border of the soft palate. Okay, it is a hanging down in the middle of the oral cavity which is made up of the soft palate. You can see in the figure, this is the uvula. Originating from the upper end of the uvula are four folds of the mucous membrane. Two folds are passing downwards at each side to form a membranous arch. Okay, the posterior folds on each side are the palatopharyngeal arches, that is near about the pharynx, that is the palatopharyngeal arches, and the two anterior folds that are near to the tongue, that is the palatoglossal arches. Okay, on each side between the arches is that is collection of the lymphoid tissue, that is called the palatine tonsil. Okay, there is tonsil. Between two arches there is a palatine tonsil. Now we will see the blood supply. First one is which is the arterial supply. First one is lingual artery, then the tonsillar branch of facial artery, ascending pharyngeal artery, Then venous drainage, that is the lingual vein, ultimately drains into the internal jugular vein. Now we will see about the tongue. Tongue is a voluntary muscular structure that occupies the floor of the mouth. Okay, tongue has a voluntary muscles, that's why we can speak, and whenever we want to stop, we can stop our speech. It is attached by its base to hyoid bone, where it is attached to the hyoid bone, and by a fold of its mucous membrane covering called the frenulum. Okay, it has a fold in the inferior side, that is the frenulum, and it is attached to the floor of the mouth, that is the frenulum. The superior surface consists of the stratified squamous epithelium and dorsum, that is the upper part of the tongue. It is covered with the papilla, and papilla having the taste receptor and taste buds. So this is all about the tongue. Now we will see the taste area on the human tongue. There is total 5 tastes are there. First one is a sweet, that is the anterior portion of the tongue, or we can say the dorsal area of the tongue. Then the salty, you can see in figure, that is lateral or parallel area of the tongue. Then sour, that is the completely lateral area of the tongue. Then bitter, that is the posterior area of the tongue. And umami, that is the whole area of the tongue. So these are the 5 tastes or taste buds found in the tongue, that is the sweet, salty, sour, bitter and umami. Now, which are the blood supply? The arterial blood supply, that is the lingual branch of the external carotid artery, and venous drainage is lingual vein. So these both are the blood supply. Now the nerve supply of the tongue. There is 3 nerves are involved. First one is the hypoglossal nerve, that is the 12th cranial nerves. Second one is a mandibular nerves, that is the 5th cranial nerves. And the last, that is the facial and glossopharyngeal nerves, that is the 7th and 9th cranial nerves. Now hypoglossal nerves, which supply the voluntary muscles of the tongue. Then the mandibular nerves, that is the somatic sensation, for example pain, temperature and touch. And the facial and glossopharyngeal nerves, which nerves of the taste. So these are the nerves of the tongue. Now we will see the function of the tongue. The tongue plays very important role in the chewing, we can say mastication, in swallowing of the food, we can say deglutition and speech. So these are the main 3 functions of the tongue: chewing, mastication, swallowing, deglutition and speech. Now we will see the teeth. In that you can see in the figure there are the types of teeth. First one is incisor, then after incisor there is the canine, then premolars and molars. Now we will see the structure. The structure of teeth. First one is a crown, that is exposed surface of the tooth, and then the neck, that is the boundary between the root and crown. Then the enamel, that is the outer surface, which is the hardest substance in the body, that is 95% calcium salt. Then the dentin, it is a bone-like structure but non-cellular, 70% calcium salt are there. Then the pulp cavity, it is a hollow with the blood vessels and nerve supply. Then the root canal, canal length of the root, and the gingival sulcus where the gum and teeth meet. Okay, so these are the structure of the teeth, and you can see in the figure. Okay, there is three main part: crown, neck, and root. Okay, in crown there is enamel, dentin, and pulp cavity. In neck it is boundary between the root and crown. In the root there is bone, then the root canal and the gingival sulcus. Now primary or deciduous teeth, that is the total 20. At the birth, the teeth of both dentitions are present in immature forms in the mandible and maxilla. Okay, at the time of the birth, there is immature form of the teeth are there in the mandible and in maxilla. They begin to erupt when the child is about 6 months old. Okay, when the child will be at the age of 6, the eruption will be start, and it should all present by the 24 months. Okay, up to the 24 months, total 20 teeth will be erupted. The permanent teeth, second type of the teeth, that is the permanent teeth, that will begin to replace the deciduous teeth in the 6th year of the age. At the age of 6 years, the child will be develop permanent teeth. This dentition consisting of the 32 teeth usually completed by the 21st year. Up to the age of 21, the 32 teeth will be erupted. So this is the primary and, or we can say, temporary and permanent teeth. Now we will see the function of the teeth. The main function is mechanical breakdown of the food. In that, incisors and canine used for the cutting and used for the biting of the pieces of the food. Okay, these two type of teeth, that is first canine and incisors, it is very helpful for the cutting and biting of the food. Then molars and premolars teeth, which has broad and flat surface area, which is very useful for the grinding and chewing the food. So this is the main function of the teeth. Now we will see the blood supply. In that, the arterial blood supply, that is the maxillary artery, then venous drainage, that is the internal jugular vein, and nerve supply. In that, the upper teeth, there is the maxillary nerve, lower teeth, there is the mandibular nerves, and both branches, that is the trigeminal nerves, that is the fifth cranial nerve. Okay, these are the nerve supply of the teeth. Now, salivary glands. Salivary gland release their secretion into the duct, leads to the mouth. Okay, there are three pairs. First one is a parotid gland, second is a submandibular gland, and third one is a sublingual gland. Numerous smaller salivary glands scattered around the mouth. Okay. Now, first one is a parotid gland. All these are the situated one on each side of the face, just below the external acoustic meatus. Each gland has a parotid duct opening into the mouth at the level of the second upper molar tooth. Okay, at the level of the second upper molar tooth, there will be a duct of the parotid gland. You can see in the figure where it is found, at the each side of the face, and the duct will be opened at the level of the second upper molar tooth. Okay, so this is the salivary gland, or we can say parotid gland. Now, second one is the submandibular gland. These lies one on each side of the face under the angle of the jaw. Okay, at the jaw. The two submandibular ducts open on the floor of the mouth, one on each side of the frenulum of the tongue. Okay, where the duct will be open at the frenulum of the tongue, both sides, laterally. Third one is sublingual glands. These gland lies under the mucous membrane of the floor of the mouth, and these have the numerous small ducts that open into the floor of the mouth. Now we will see the structure of the gland. These glands are all surrounded by the fibrous capsule. Okay, it is surrounded by the fibrous capsule. They consist the number of the lobules that you can see in the figure. That it has a number of the lobules. Then the lobules, it is made up of the small acini. Each lobule has the small acini lined with the secretory cells, and the secretory cells secrete the secretion. The secretion are poured into the ductules, and they join up to form a larger duct, and the larger duct will be open into the mouth. So this is all about the structure of the gland. Now the blood supply, that is the carotid arteries, and the venous drainage, that is the external jugular vein. Now the composition of saliva. 1.5 liter of saliva, it is produced daily, and it consists of water, mineral salt, digestive enzymes, that is the salivary amylase, then the mucus, then lysozyme, immunoglobulins, then the blood clotting factor. These are the composition of the saliva, and daily 1.5 liter saliva is produced. The secretion of saliva. The secretion of saliva is under the autonomic nerve control, that is the parasympathetic stimulation and sympathetic stimulation. Parasympathetic stimulation cause profuse secretion of watery saliva with a relatively low content of enzyme and other organic substance. Okay, it has low content of enzyme. Then the sympathetic stimulation, there will be a secretion of the small amount of the saliva rich in organic materials, and especially from the submandibular gland. The reflex secretion occurs when there is food in the mouth. Okay, when the food in mouth, the saliva will be secreted. Now the function of saliva. First one is a lubrication of food, then cleaning and lubricating the mouth or oral cavity, then non-specific defense, okay, then taste and chemical digestion due to the enzymes. So these are the function of the saliva. Now process of the mouth. First one is a mastication. What is mastication? That is the chewing of the food. Then mixing masticated food with saliva to produce easy digested food called the bolus. Okay, then it will be mixed with the saliva and they produce bolus. The saliva contains two enzymes, that is the salivary amylase and lingual lipase. Okay, the initiation of the swallowing by the tongue and the allowing for the sense of the taste. So these are the process occur in the mouth to the food. Now this is all about the oral cavity or mouth. If you have any query, you can comment me or you can ask me. So this is all about the anatomy and physiology of the mouth or oral cavity. Thank you. Hello guys, I have made video for you. This is the educational video as a part of anatomy and physiology. If you like my video then please subscribe my channel and like the video. Thank you.